Hello, everyone. It's good to see your names popping up. Thank you for joining us today. Hello. Hi, Andrea. Andrea. All right. Well, we'll give folks another minute to join, but we are very happy to see you here. I think we've got a lot of good stuff today. So hi, Sarah. Is this your first meeting with us? All right. Well, welcome. Welcome. We're happy to have you. This is a good group to learn from. So awesome. All right. Well, I will tell you right at the top that we do not have representation at this point in the meeting from partnership, but we will around 1:40, no, was it 1:45? When we do our breakout group, when we do our first discussion. We've got two discussions today. We're going to do our first discussion, you'll see in a minute what the agenda is around our PDSAs. And so Ashley Peel, the ECM program manager from Partnership, is going to join us for that. So hopefully we'll have some really good co-learning. So I think I will pass it over to Eva, who's going to walk us through some initial information.
Hi, everyone. Welcome to session 8. Shiva, do you mind going to the next slide? So welcome back to CPI, or if it's your first time. And just FYI, per usual, we are recording this session and we'll make it accessible to you all afterwards. Next slide, please. And so we're just going to start with making sure that everyone has their Zoom name updated. Make sure you include the name of your organization. We would also love to just get everyone's voice in the room to start off the meeting with an icebreaker question, which is, if you could bring back any fashion trend, what would it be? And we're really looking forward to a dynamic session. So please always feel free to use the chat, raise your hand, unmute. We just want to make sure that this is a collaborative space. But if everyone wants to put their answer to the icebreaker question in the chat, we can get started. Any fashion trends? Turtleneck sweaters. Bell bottoms, yeah, bell bottoms are making a big comeback. Thanks, Alexis. So today our objectives are as follows. By the end of this session, participants will receive resources for implementing ECM and CS services, understand how TA Marketplace funds can support their work and their workforce, share promising practices and brainstorm solutions along the provider journey, and also set priorities and review progress of the Northeast Collaborative. Next slide, please. Full shirts, not half shirts. That's a good one. I like that. So our agenda for today, we've broken it up into 4 parts. Part 1 will be dedicated to resources. After going over the agenda and setting our objectives, we'll give updates on our in-person event, talk about the CHCF survey, as well as resources for implementing and funding ECM and CS. Part 2 will focus on implementation, and this is where we'll have some breakout sessions for sharing best practices and brainstorming solutions along the provider journey. Part 3 will be dedicated to CPI progress. We will do an overview of the results of the CPI participant engagement survey, touch on the gap analysis of the CPI objectives and progress, and also discuss the CPI priorities for Q3 and Q4. And then finally, we will close out by discussing next steps, doing some session 9 planning, and talking about resources and kind of what we can expect moving towards the next session. Next slide, please. So before we get started, we wanted to provide an update about our in-person session. I know there's been a lot of back and forth. There was another event that was taking place during the date that we had sort of originally planned to do this session, but we do have an update for you. We are planning on holding our in-person session at Partnerships office in Reading on Monday, October 30th from 12 to 3 p.m. As stated in previous sessions, this is really a chance to engage in some relationship building with your peers, relationship building with partnership, provider training for capacity building, as well as it'll be an opportunity to share promising practices and solutions, as well as it'll just be a great time to see each other in person, share a meal, and kind of be able to celebrate all of the great work that this group has done over these last months. Next slide, please. So now just wanted to flag the participant experience survey from CHCF. They are running a survey to gauge the experiences of CBOs with CalAIM implementation. And so they're wanting participation from current ECM and CS providers, CBOs who decided not to pursue a contract for ECM and CS services. And the survey will be open until September 8th. Information about the survey, there's a $25 honorarium, takes about 20 minutes to complete, and data about your organization's services is needed to answer some of the questions on the survey. And the link is here, and we can put that in the chat, as well as it'll be accessible when we send out the materials after the session as well. We also just wanted to highlight that this is different than the previous survey that you filled out. That was a survey from DHCS about your experience with this specific collaborative. So it was a different sponsor and a different purpose, just to make sure that everyone understands it's separate than the survey that was previously disseminated. Next slide, please. And Alexis put the link in the chat. So we want to move into doing a few polls. We want to get your feedback on a couple of items, and I'm going to pass it over to Gabrielle to just give a little bit more detail about why we're polling about Medi-Cal education here.
Yeah, thank you, Emma. So we've got a couple of polls just about topics that have come up in our discussions, either with DHCS or with some of you during office hours. And we wanted to get a little bit of background information from you as a group in order to inform future sessions. So the first one is about Medi-Cal redetermination. So we know that the state right now is really pushing that anyone who engages with Medi-Cal members in any way really encourage people to keep their addresses updated, their contact information updated with their county human services agency, so that when it comes time for their Medi-Cal to be redetermined, that it's easy to contact them, and that they don't miss they don't end up inadvertently losing Medi-Cal eligibility. So one thing we were wanting to know from this group is, does your current process include education or reminders to clients about how to keep their Medi-Cal active? And the distinction here is, yes, we are kind of actively helping clients, like helping them to call human services, or helping them fill out the paperwork, or do you give them reminders but not necessarily that hands-on help? Or is this not part of your process at all? Or maybe it doesn't apply to you as a provider, or maybe you're not a provider. So if we'll give a minute to fill that in, that would be super helpful. All right. Thank you. And I would imagine also that, what service you render and which populations you work with might impact the answer to this. And there's no right or wrong. We're just curious on kind of seeing where collaborative members fall in this and whether this might be a topic that would be of interest. And if you have any additional comments on this, please put them in the chat. That would be really helpful. Okay, so it looks like some of it doesn't apply. So, and some of you are like actively helping folks. Okay, great. All right, well, thank you. Appreciate the feedback. All right, then the second one is this actually came out of office hours that we held. One of you suggested, who was a sort of on the ground case manager, like not a program director or program manager, but actually somebody rendering case management services directly with clients, said, you know, a lot of the discussions that we have at these CPIs are a little higher level, but I could really use some help connecting with other case managers who are working directly with members to share best practices, you know, kind of learn what are different local resources that are available. And so we're trying to think about whether this, you know, how we as a CPI can support that communal learning. So the question is, would your on-the-ground case managers be interested in connecting with other case managers in Northeast counties to share best practices and brainstorm solutions? And if there's a lot of interest, then we will continue to really think about how we can support that. Oh, give a minute to fill those out. All right. Okay. And thank you, Doug and Andrea, for the additional comments. It's really helpful to have that added context. Okay. Wonderful. All right. Well, it looks like there's interest, so we will get back to you. We'll continue to explore ways to connect folks, and we'll get back to you hopefully shortly. All right. I think we can go to the next slide. Awesome. And just one last one, and this is also impacts a little bit the last question, is we're curious where folks currently go to get information or guidance. So if you have a question about enhanced case management or about community supports, look, what are some of your go-to places? You know, we try to provide information as much as possible, but we don't want to duplicate information that you're already getting. So, you know, are you going to the DHCS website, to partnerships website, somewhere else? You know, what are kind of your go-to places for getting information? That would really help us. Roundtable meetings. Okay, awesome. Yeah, that really helps us to get a sense of what information you're already exposed to and where there might be gaps. So we can just add those to the chat. That would be super helpful. And I think with that, we can move on. All right. So we're going to share, wanted to highlight for you some resources. Speaking of, you know, sources of information. So the first, you are probably all well aware of, but wanted to make sure in case there's any new folks, that Partnership hosts trainings about authorization and billing. So you can use these links here to register. They're coming up next month. They have one on each topic. And then I highly, highly recommend that you attend the provider roundtables that Partnership hosts as well. So you've got the dates and the registration links there to make that as easy as possible. And those are, you know, places where you can bring up questions that you have directly with Partnership, get some answers, and also, you know, uplift issues that you're experiencing. All right, go to the next slide. Another thing is, so we spent some time at the last session going through the content of the policy update that DHCS released in July. And they've now released, in recognition of feedback that they received that the policy update was a little dense and a little maybe hard to understand, they have they recently released a cheat sheet. So I highly recommend that you check this out. Now, that said, if you read the policy guides and you were all good with that and that made sense to you, then there's no new information here. It's all the same information, but this is just an easier way to read it, essentially. So you've got the link to the cheat sheet here. One of the really nice things about this, and I guess this is probably the one new piece of information, is in that second column where it says level of DHCS standardization. This is DHCS indicating how standardized across the state or across the health plans that particular guidance is. This can be really helpful to you as providers or as stakeholders because it tells you how much flexibility the health plan or partnership has in changing their own processes. So if the level of standardization is low, that means there's a fair amount of wiggle room for partnership or if you're also operating in other counties, for the health plan to kind of alter or adjust policies based on local need or based on your provider feedback. If the level of standardization is very high, it means DHCS or the state has pretty much set what this needs to be, and unfortunately there's not going to be a lot of wiggle room there. So that can be helpful as you're having conversations with partnership and as you're uplifting issues and topics with us. To help brainstorm solutions, we can know, well, these things we can change, and these things are probably harder to change because they're at a policy level. All right, so highly recommend you check that out. And then the last resource that we've talked about in the past, but we really wanted to uplift this because our sense is that the TA marketplace is under leveraged or underutilized. And please, if you have questions about the TA marketplace, please send them to us. We would love to set up time to talk with you. We'd love to talk to you during office hours. But so the TA marketplace it's a source of funding, essentially, from the state for providers, for ECM and CS providers, or for organizations that are providers. And it covers a whole range of technical assistance. But one of the ones that we wanted to really highlight is the technical assistance related to workforce development, because that, we've heard from some of you in the collaborative that workforce development is hard, like whether it's getting the right, being able to find and hire the right people, whether it's retention of the right people, whether it's building capacity of the folks that you have. There are free resources available to you for exactly this. So we wanted to go over kind of a couple of examples specifically. So one is you can get consultant help for free because it's already funded through DHCS with whether it's things around kind of how you design your staffing models to provide services. You can get help with like sample job descriptions or best practices for what ratio might work best between client and case manager. Different kind of best practices around case management in general. Or kind of how you think about the capacity that your organization is able to take on. And if you want to be able to take on more capacity, what might your staffing models need to look like in order to do that? They can also provide you direct support with building the capacity or capability of your existing team around a topic that maybe your existing team doesn't already have a lot of specialization in. So let's say, you work with a population that unlikely, but let's just go with this for a second, that you work with a population that or at least the population you historically have worked with hasn't really encountered substance use disorders. That's not a big part of what you've done historically, but now you're needing to support clients that are struggling with that. they can, give you coaching, give you training, you and your teams, training to, upskill in order to meet those evolving needs that you're seeing. And then again, like we talked about, they can also really help with recruitment and retention efforts. So figuring out, how do we get the right people with good lived experience, maybe some Medi-Cal experience, how do we tap our market to get really high quality folks, and then retain those folks at your organization. So again, if you have questions about this, we would love to talk with you more. It's a free resource and it's hands-on. It's not like a brochure. It's hands-on consulting for your organization. And yeah, Alexis, do you want to add to that?
Yeah, thank you so much, Gabrielle. I just have two really quick points. I think it's so important for us to just uplift that all approved projects, like when you as an organization go onto the TA Marketplace's website and you apply to be a receiver, a provider organization that needs these services, the project that you get approved for is fully funded. I think that is like the most important for us to reemphasize and validate. And the reason why this is so important is because we are observing a disconnect between some of the issues that have been presented by CPI stakeholders across the state and the number of applications that have actually been received, like on the TA Marketplace. And so you do have these two different options for that technical assistance. You can go onto the website and receive support with a project that you quite literally want a consultant to literally scope out with you and literally have hands-on, like one-on-one technical assistance, you and that vendor. Something that is just very closely built out and implemented together. And you also have an option to peruse the TA Marketplace to see what services are already pre-designed and maybe a little bit less tailorable, but you can just look at the pre-designed services and purchase one of those options as well, once again fully funded. So I just want to make sure everyone understands that you do have those two distinct options between receiving hands-on support or reviewing services that are pre-designed and might fit into your needs, and that those are fully funded. And then secondly, I also just wanted to call out that we had this amazing piece of feedback in the chat right now from Andrea, and I just from Visions of the Cross, and I just wanted to know, Andrea, do you have just 30 seconds to really entertain us with this process and how you went through it, because this is just amazing feedback that your organization was awarded over $120,000 worth of training. That is not something that we hear often, and we think it's because of that disconnect that we're calling out right now. A lot of providers just haven't applied, and so would love to hear just more about what your experience was.
Sure. Thank you, Alexis. Hi, everybody. Andrea with Visions of the Cross. So initially, you have to receive from your managed care plan, you have to get the attestation form signed in order to be eligible to apply for the TA Marketplace. Once you have that attestation downloaded and signed from the managed care plan and from your organization, then you can go on and you can shop. So, and as Alexis was saying, you can shop for off the shelf, which is basically a training that they've already formulated, and you can kind of go in there and change things around. Or you can do off the shelf where you actually create your own type of technical assistance training suitable for your own organization's needs, tailored by obviously your team members, so that it benefits you more. So basically you'll go in and you'll apply for it. I think there's maybe 10 questions. It's really not that much. And then it just asks how it pertains to building your organization. Have you applied for grant funding that is relative with this? Do you participate in any groups? Obviously this group, and you can write how this request correlates with your group needs and stuff like that. And then so the ones that we did receive was for community supports for addressing social detriments of health, and then for ECM, what happens next. So we have our ECM program already running, but where do we go next? So why not grow more and apply for it? So we did, and we got it, and our training begins on September 18th. So I'll let you guys know more. Yeah.
That is so incredibly appreciated. And we will definitely look forward to like the outcomes of that technical assistance. And just as Andrea stated, you really do have these options, to like identify something that is already pre-designed off the shelf, or to work with a consultant to design the TA needed that is very specific and unique to your organization. And this is at no cost to your organization. And so even as a part of CPI, some of those tests of change that we have recommended is quite literally going to the TA marketplace. Like we've identified the issue that you're facing, for example, as Gabrielle mentioned, pertaining to workforce. And so like if there is this very specific subset, the test could quite literally be going to the TA marketplace and going ahead and partnering with your managed care plan to submit that application. And then just because I'm hijacking the meeting at this point, is just to do a very quick recap of what those domains are. Those domains that you can request support are building data capacity, community supports, engaging in CalAIM through Medi-Cal managed care, enhanced care management, promoting health equity, supporting cross-sector partnerships, and workforce. And as Andrea also called out, they were approved for 2 projects. So this doesn't mean that you are one and done. If you submit for one project, you're able to complete that project. You can feel more than free to apply for another. And so once again, just re-emphasizing this incredibly amazing resource that was provided quite literally in direct response to what stakeholders have identified as a need for that technical assistance. And so just really wanting everyone to understand that this resource is available to you and it would be at no cost to your organization.
Awesome. Thank you, Alexis, for that additional information and overview. Really important. And thank you, Andrea, for sharing your experience and guidance. It's super, super helpful. And congratulations on getting all that funding. That's really exciting. So we will jump in now into part 2 of our meeting, which I will present a little bit of information, and then we're going to break out into groups and do some discussion. So first wanted to review, yes, and this part 2 is all about continuing to find solutions along the provider journeys. There we go. And so this is just kind of one, I highly recommend that you go back to this slide and spend some time with this slide on your own, because I won't go into the detail of all of it, but there are some real gems here. And what this is the best practices that we've heard so far, both from you in this collaborative, as well as from the other CPI collaborative that Health Begins facilitates for, which is in Stanislaus and San Joaquin counties. So just, kind of some of the best practices that we can highlight. One is as we've talked a lot about, is hiring staff with lived experience, but also understanding that you may need to build in some extra support for onboarding for those folks, right? If they haven't had a more traditional case management path. Hiring staff with Medi-Cal billing experience. We've talked a lot about the PDSA model, right? Plan, do, study, act, where it, test your process changes before implementing them full scale. That can really save you some time and headaches sometimes. Standardizing outreach processes. So some of you have talked about creating little intro cards or checklists to kind of standardize the process that you have for doing that initial engagement or outreach with clients. A big one we've spent a lot of time on is trying to think about what are the existing data sources that you could get client contact info from. So, especially when you're having trouble in locating or getting in touch with a client, who's new to you, what are other sources of data that you could maybe tap to try to get in touch with them. Definitely encourage you to have your teams attend the Medi-Cal training academies. Another piece is investing in staff training and development as a way of retaining folks. Excuse me. And again, the TA marketplace is huge for that. And then I think one of the biggest pieces that we haven't talked about as much, but that our next session, in the one that's in person, is going to be heavily revolving around this, is really around learning from your peers and developing those relationships with your peers. One of the things that we've heard really loud and clear is from folks is that their largest sources of success have really been in learning who their local partners are and then proactively engaging with those local partners to break down silos and establish warm handoffs, build those relationships. And then, being able to, because you then have those relationships with your local partners, you can then, share information. If you have information, ask questions, receive that information, and really be able to effectively, case manage across organizations and across entities and across health systems that your joint or shared client might be engaging with. So we are going to dive into these during our discussion in a minute, but I just wanted to share some of these, one for you to kind of have as a resource to go back to, but also because if there are templates that you use that you felt like, let's say you have a checklist, or let's say that you have, a process workflow or something that you found really helpful, if you are willing to share it with us, then we can share it with this collaborative, and would love to just, the more that we can avoid duplication of efforts. We understand that every single one of your organizations is strapped for resources and time. And so the more that we can share with one another, the better. Yes, and with that, we'll go to the next slide. Yeah, Alexis?
Yeah, and I actually just wanted to just provide a little bit of color on that template note. For example, in the San Joaquin and Stanislaus region, we had a one-on-one recently with a stakeholder that on their own independently developed, a claims checklist, and they developed this checklist first for ECM processing, right? And they worked with their managed care plans, both of them, to really determine internally, what does this workflow look like? And as a result of them working with the plan to develop that template, that workflow, they stated that they now have approximately a 99% approval rate with all of their claims. And so as a result of that, they've shared this template with us, and we're going to work with the plans to see if this is a template that we can share with multiple providers. Once again, trying to reduce that duplication and concurrently address a need that has been identified. For example, unexpected auth denials. So that's just one example of a template that we would really like to start sourcing, so that way everyone can have access to this shared knowledge. So just really doubling down on how important those templates can be and how useful they might be in practice.
Thank you, Alexis. And while we have you, do you want to share a little bit about what folks can expect from the Medi-Cal training academies, and where I'm trying to pull up the link right now so that we can share that with you. But do you have any background you can share with that?
Yeah, for example, one is CSH, the Corporation for Supportive Housing. So there are various organizations that provide very specific training. They might be related to a specific community support. And then also going back to the TA marketplace, we mentioned previously that there are very issue-based trainings that are available on the marketplace. So it would be very dependent upon your unique organization, either the population of focus that you serve or the community supports offered, to determine what specific training that you might need. And that training could come from, a partnering organization, or it could come directly from the TA marketplace. And in both of those situations, there would be no cost, which is the most important thing. So I know that, I'm beating a dead horse on this no cost, consideration, but because of that low utilization of those hands-on technical assistance services provided by TAM, we just want to double down on the access of those services or those trainings that are available based on the services that your organization renders. And we can also dive deeper into that into the breakout rooms as well, and maybe even screen share what some of those sample projects look like.
That would be great. Thank you, Alexis. And I'll also highlight that if you are newer to Medi-Cal, DHCS also hosts training academies that are training sessions online that are kind of overviews of Medi-Cal. So who does Medi-Cal serve? What are the eligibility criteria? Kind of just the overall information. So yes, we will get you those links. Absolutely. Doug, did you want to share?
Yeah, I'm not newer to Medi-Cal. I was there when Medi-Cal managed care was developed with Molina Health Plan as they built up. But yeah, I would like to offer my assistance with that denied authorization and how to get those approvals done properly, because I was at the receiving end of that for many years. My question was for the speaker that was previous was, one of the struggles that providers have is connecting with those patients that are in need of preventive screening services and then just routine care, and entering them into care management programs with the connection that we obviously see to their IHSS workers that they've been authorized to have, because our doctors are signing those papers to authorize that. So when that happens, is going to be, I'm hoping I'm with some other groups that the HIE is going to resolve some of that, that we will have a direct connection, and we should have a phone number and email, so on and so forth, of that caregiver that's been provided to that person, because that's a critical element to manage a person that needs assistance with the person that's assisting them. You just can't do one without the other. So I'm hoping that there's some workshops that maybe you guys have vetted this out a little bit. And if there is, I would love to be involved with that.
Thank you for uplifting that, Doug. Yeah, I mean, I think that the issue of having good information on folks' caregivers is huge. And often the managed care plans, will have information about someone if they are considered their authorized representative or like a conservator. But as we all know, plenty of people, they don't have conservatorship, but they, have caregivers that are really handling everything in their homes or for them. So yes, thank you for elevating that.
And the state is paying for the IHSS. So state has oversight of that and authority over that. So there should be some way to connect the dots with this.
Absolutely. Yeah, no, and like you said, hopefully the health information exchange will also help solve some of those problems. But thank you for sharing that. I think that's a really important topic. Great. Well, I think we can go on to the next. I'll scoot us along here because I want to make sure we have time for discussion. So these were just, again, in the spirit of best practices, or as we are starting to call them, promising practices, because, if we're just trying things out early, we may not know whether they're the best practice, but we can say that they're at least promising. These are some of the requests that we have uplifted or shared with DHCS recently. And these all came out of these collaboratives. So, one was just to address the issue of low awareness in general about CalAIM services. We asked DHCS to think about whether there might be a CalAIM curriculum that they could develop that different, Medi-Cal providers would either be required or recommended to take. Another idea that it has been floating around a lot that seems really promising is looking at the role of potentially an intermediary between the health plan and the community-based organizations. So some have called this a hub model. We can definitely go into more detail about that in a future session if there's interest. But basically just recognizing that there is a lot of administrative burden for smaller and local community-based organizations in partnering with the health plan to do all of, to render these services. And so if there was a way of having, some type of organization that could handle all that administrative piece, and then the local organizations potentially could contract with that entity that would handle all of their auths and claims and, kind of the contracting and all of that stuff. So that is currently a discussion that's happening at the state level. So just wanted you to be aware of that. And then the other piece is around looking at, are there universal systems or processes really to, again, try to diminish the administrative burden related to auths and claims and referrals and all of that. So wanted you to know that these are some of the learnings that have come up from this collaborative that we've been sharing with DHCS. And again, just as we're thinking about best practices and both current state, what are you trying that's working or not working? And also kind of more at a systems level, what would you like to see? This is along those lines. So all right, now let's jump in here. Let's go next slide, please. Awesome. So if you are new to us, we have been throughout this collaborative talking about a model that's called the PDSA model, which is a way of trying out changes to your workflows or your processes to try to see if you can make them more effective or more efficient. And so very quickly, it's the idea is that you first plan out what's the change that you're going to try out. You then do the change. You then think about, and when you do it, it's at a small level. You don't completely change your whole organization. You like do a small test of change. You then study it. So you think about, did it work? Did it not work? Do we need to change something? Do we need to tweak it? And then once you're finding that it's working, you can then make a decision of whether you want to standardize that change across your organization or across a workflow, which is the ACT portion. So I know that all of you are probably in different stages of your PDSA. So first, just a quick question for you. We'll go to the next slide, please. Which is, oh wait, sorry. Before I ask you that, just a reminder that we are here for office hours to talk about any and all of these topics. We've had some really wonderful conversations with some of you around your PDSAs and brainstorming your different PDSAs. So you've got the information there, and we can go to the next slide. Awesome. All right. So here's your question, is just so that we have a sense of where people are. What phase are you currently in of your PDSA? And if everyone can answer this, that would be really much appreciated. Our goal for this collaborative is that by December, at least 75% of you will have completed a full PDSA. So that is one of the ways that we measure whether we're being successful in this collaborative as your facilitators, is that at least 75% of you will have gone all the way through. So does not need to mean that today that's true, but knowing where you are today gives us a sense of what we need to do and where we need to focus. All right, so it looks like some are still in plan, some are in ACT, and some have not yet started. So, all right, okay. Well, good news is that today we are focusing, this is a really big area of focus for today. So we can go ahead to the next, and please go ahead and fill that out. It looks like we only have 7, or we probably need a couple more folks to fill out their poll, but all right. And then the next poll is for those of you that have been working on a PDSA, is what improvement area have you been working on? So is the process you're changing related to workforce topics? Is it related to care coordination, data sharing? Please pick whichever one is most applicable to you. That'll also give us a sense of what is most pressing and what are the areas of your workflows that you're really focused on. All right, I see we've got some capacity building, some care coordination, some workflows. All right. Okay, great. Well, I think then we will go ahead and jump in. Let's see, let's do next slide, please. So we are now going to jump into our breakout rooms. And today's breakout rooms are not based on your contracted status, as we've done before. These are based on what you're more interested in talking about. So breakout room A is going to focus on the front part of the provider journey. So referrals, outreach, and authorization, actual case management, the actual rendering of the services. Breakout room B will focus on issues around submitting claims and submitting data to the health plan. And Ashley, thank you from DHC. Thank you so much for being here. Ashley is going to kind of jump in one and then jump in the other. So hopefully you'll see her on the front end or back end of that. And our discussion is really focused on where you are in your PDSA, in particular for those that have started trying things. What have you learned from your PDSA so far? What changes have worked well? And what we're really interested in is what can you recommend to your colleagues? Is there anything that you've tried, even if it's really small, that you've tried that's really been successful to you that you think your colleagues and peer organizations might learn from or might appreciate as well? So we will go ahead and please pick your breakout room, which is down. If you go to your Zoom, down below, there should be an icon for breakout rooms. Click on that, and then you can pick whichever one you want to go to, and we will see you over there. We've got about 20 minutes for this.
Hey everyone, and we are just hanging back for a little bit to make sure everyone feels super comfortable with
I
knowing.
don't see how to
breakout.
get breakout room where
Oh, no problem, Doug. So if
I'm
you
on an iPad and I'm not getting the option.
No
here.
worries,
no
Doug.
problem.
Which room did you want to join? Did you want to join room A or room B?
The one more with case management.
That would be room A. So
Let's go to our next slide, and we're going to dive into, the next one, dive into part 3 now. So this is less about your processes as organizations and more about what you'd like to see from this collaborative, from this group. So we'll share a little bit of information first on some of the survey feedback that we got, and then we've done a gap analysis that we want to share the results with you and get your feedback on kind of what you'd like to see going forward for the next 2 quarters, since we're about midway through at this point. So really quick, so thank you that 4 of you participated in the survey. So I know that our N is not that large, but that's okay. I'm very grateful to the 4 of you who participated. So this was a survey that DHCS put out trying to measure your experiences with the CPI. And so overall, the participant experience and Health Begins as a facilitator, pretty good, some room for improvement, but overall pretty good. It looks like, based on the, our small participation, about half of folks had started testing or implementing a practice change for improvement. So again, that PDSA piece. Again, our goal is that by the end of the year, we'll be at 75%. So if you need help thinking that through, please let us know, come talk to us during office hours or set up a one-on-one. We're happy to make time for that. But overall, this kind of gives you a sense of where we were. Some of the key takeaways that folks shared were that they had learned kind of how other community partners were launching their programs. They had learned about other community resources and the PDSA process, and had got clarification about some questions like billing. So quick question on this one, which will go to the next slide, is another poll. I'm just curious whether these, and let's go to the next slide, please. All right, so curious whether these results resonate with your experience of the collaborative. And please answer honestly. We are not searching for kudos here, just trying to get a sense of whether the 4 people that responded are representative of the larger group, or whether there's some bias given our low participation rate. So if you wouldn't mind giving us this feedback. Of course, if you have any other comments to add, we would love for you to share those in the chat, or send us an email, come talk to us. This space is really for you, and so we want it to be valuable, and we want to create agendas and content that resonates and that's of interest. So We'll just do that poll really quick, and then we will dive into our second discussion. Did that poll come up? I don't see it. No, huh? Oh, there we go. Okay. So we'll give a minute to go get some of those answers, and then we'll jump in. All right. Thank you. Okay, wonderful. So it looks like relatively representative, which is good. All right. Okay, thank you. So let's jump into, I am just going to share the results of this gap analysis really high level, so that we can focus the rest of our time really on discussion and getting your feedback on this. So what you're looking at is the content in black there are the ideas that we had set out back in January, the ideas we had set out that we wanted to engage in with this collaborative. So what do we want to accomplish? So we have kind of overarching goals, but what are some specific ideas for what we'd like to do with the collaborative? And as we've gone, emphasized based on our impressions and based on feedback we've gotten from you all, we've emphasized some over others. And so you can see that in that green column, which is the on target, these are the ones that in looking at what we had set out to do, these are the ones that we think we're on target. We've been engaging with these, so they, a big piece is around workflows. So we did the provider journey mapping. We've been, talking about PDSAs. We've been talking about best practices throughout. In terms of data, that's one where we haven't really done as much so far. I think that we're on target with data in terms of DHCS is now recognizing the need for more standardization, and that is feedback that came out of this collaborative. So I think that's really good. But some of our other ideas around data, we put in the improvement needed section, which was, for example, talking more about the health information exchange and finding funding opportunities for providers to build, like if you don't already have the data infrastructure that you might need to ideally maximize your time around, entering data and submitting data to partnership. Also, we haven't really talked a lot about mapping the reporting requirements or really about technology solutions that might be helpful. In terms of capacity building, I think that's one where we have done a fair amount of discussion in these collaborative sessions, but there's also, more that can be done. So I'm curious, as you look at these, and we're going to spend a little bit of time on this slide, as you look at these, are there, the first question is, are there areas that you'd like, that you think we've put in the wrong column? Like, oh, I don't think we've made any progress on that. You got to put that one back in the red. Are there ones that are particularly in the yellow attention needed column or in the red improvement needed column that you'd really like to see us prioritize in the next 2 quarters? Because we have this Q3, Q4, so we can really emphasize some of these over others. So we're just going to open it up to the floor. Please add in chat or, come on and share. Would love to hear your voices, because this is really going to influence what content we put forward for through the rest of the year and what would be most helpful. So give folks a little bit of time to kind of read through and review that, and would love to hear
I would like to hear more about, like you say, on target with capacity building and the existing IPP path cited funds to fill workflows and knowledge. Do you have a spreadsheet that identifies this, or what are you using for that component?
Yeah, absolutely. So this was something that we had gone over in a lot of detail during session 4, so several sessions ago.
Okay, I'm sorry, I'm late to the game, so
no,
need.
not at all, not at all. So, but yeah, but point being, we have a whole slide deck around it, which we can absolutely share out. And we've actually been talking about doing a refresher of that content because it's been months now since we've talked about it. So knowing that that is of interest is really helpful.
Yeah,
we can absolutely circle back to that. Great, thank you, Doug.
So we are currently working on potentially getting some technology under your improvement needed, the last one on there. We're working on some technical solutions over here, which we kind of talked about in our breakout session, as far as how we can streamline a lot of reporting processes and getting the collection of data. We're really excited about what is coming for that. And so I'm hopeful that we can address those more maybe inside of this group and report out like how that's going, because I'd love to share if it's going to be something that we should all move towards or maybe avoid. Hopefully not that one, but you know, just wanted to call that out in this space as well.
Absolutely. Thank you, Christina. I think that's yes, very well said and a really good point. And I agree that that is really an area where we haven't spent a lot of time so far, but is definitely one where we need to be, we need to spend a lot more time talking about that. So great.
Yeah, and I actually just want to follow up on that because in our breakout room, one of the points that Christina mentioned was that because CalAIM is so unique in implementation, that TurboTAR is creating a new service for Turbo CalAIM, and I had not, even heard about that progression yet. And so being able to number one, like learn if there are other providers that are considering like using this data platform as well, and then in subsequent sessions being able to talk about like what that progress looks like, I think is really going to be super helpful in that area. That's exciting.
I don't want to take up too much of the time, but another thing that we really need more collaboration, I'm hoping to get more and more from this group, is the referral process, just being able to have the clear communication, not just with partnership, but with other providers in the area to make sure that we're all being able to provide the service that's, best for our participants. And I know we've had some hiccups, especially along those lines of being able to get clear referrals or making sure that we're able to provide the service that they're actually requesting. Mm-hmm. And I know it's under the attention needed, and that's something that is a definite high priority item for us here.
Awesome. No, that's really helpful, Christina. And I think the more that we can get specifics on like what aspects of the referral process are breaking down a little bit or not as fluid as they could be, is gonna, I think, be really where the gold is there. So maybe we can connect offline and incorporate that as a topic for a future session, because I imagine that you're not the only one encountering some of those referral issues. All right. Any other input on where you, or it can also be something that's not on here, but that you'd really like to get from this space? Again, it's for you. So also additionally, we're creating the agenda right now for our in-person session next month, so, or I should say October. So if you have thoughts about what you'd like to see during the in-person, that's another thing that we are very, very open to feedback around. Any other thoughts? All right, well, if you think of anything, send us an email. With that, then I think we'll move on to part 4, which is kind of our wrap up. And yeah, sorry, Shiva, I kind of those are talked through that. All right. Great. So our last poll, I promise it's the last one, is what section of today session was most valuable? Again, we really appreciate this feedback and we use it when we develop materials as we go. So thank you for participating in this one final poll. All right, so it looks like kind of all around the resources, and it looks like the discussion on priorities are winning out. All right, great. Well, we will make sure to continue highlighting resources then, because it sounds like that really resonated with folks. So definitely continue to do that. Great. All right. Well, with that, I will hand it over to Eva, who's gonna wrap us up here.
Thanks, Gabrielle. So looking ahead to session 9, we want everyone to continue working on your PDSA, depending on where you are in the process. And there are just a few kind of questions to consider as you're going through that template. And additionally, if you need any support while you're going through this process, please feel free to reach out to us to schedule a one-on-one. We are available to schedule those kind of according to your schedule. And we'd love to help you think through your PDSA and any best practices. But another opportunity to receive support is during office hours. We have our September office hours are on the 5th at 2 p.m. And then we have office hours on October 3rd at 2 p.m. and the Zoom link is here. I also just wanted to kind of flag that we will be sending out an RSVP for the in-person session. So please keep an eye out for that so that we can get a sense of who's available and who will be able to join us. And so, as always, we want to give a special thanks to our Health Begins project team, as well as Gabrielle Alt-Richer, our wonderful facilitator for the Northeast Collaborative. And then, next slide, please. We just want to thank you all so much for joining. It's really wonderful to look back on everything that we've accomplished during this collaborative so far. And then the next few slides will include some resources that you can go ahead and access if you have questions about the upcoming trainings and roundtables that Partnership is hosting, as well as some other resources. Those will be here in this deck. That will be included in that external resources folder that I included in the chat, but it will also be sent out after the session. So thank you everyone so much. We hope you have a great rest of your week and we'll be in touch. Thank you.
Thank you, everyone. See you at the next one.
Thank you.
Thanks. Oh,
everyone left so quickly.
Let's see. Are we good? Do you want to touch base now, or do we need to like go in a different Zoom?
I don't think it really
just go in a different Zoom. Like,
yeah. Why don't we leave and then we'll go into the other link, and I'll find the sheet. Okay.
Can you send it to me? Because last time I like figured it out.
Yeah, no worries.
Okay.
Okay.